Hi everyone. So today's topic will be mental status examination. As we already finished case history taking in 2 sessions, now I'll be discussing about mental status examination. It is an examination or observation or interviewing about a mental status of a person. Okay. So there are few points under which we can do a mental status examination. The first point is general appearance. Okay, so in the general appearance you will be just observing a person and noting down the points. Okay, so it is about gender, age, physique and cleanliness of a person. Maybe it is called as demographics and any other distinctive types like his clothing type, maybe about his gender, maybe about his age, maybe about his physique, and about his gait, about his postures. You can note down about being whether he is groomed or well groomed, whether he is tidy, untidy. All those things has to be mentioned, and it is done with the observation. So as I already told you, you can do a observation and note down few points, and you can ask few questions and note down few points. So under examination you can observe and ask the questions to know the information. The second point will be behavior. So under the heading of behavior, so you'll be mentioning about a rapport building, about psychomotor activities, about movements disorder, about impending violence. So it is about like whether the rapport is built or not, whether the person is comfortable with you. When you are asking few questions, he is answering. When you started conversing with him, so he is responding. So that means the rapport is built. And psychomotor activities like his eye to eye contact, maybe about his gestures, maybe about his expressions, maybe about his body language. Okay, so how he is behaving, about his mannerism you can note down. And few movements disorder like tic disorders are making non-voluntary movements which are repetitive without his conscious he'll be doing. So whether those kind of movements are noted down or not, that has to be mentioned. And impending violence, whether the person was calm, whether the person was anxious, whether the person was little arousal, agitated, that and all has to be mentioned under the behavior heading. Okay, so rapport will be built or not, rapport is built or not, that has to be mentioned. Then psychomotor activities, then moments, then about the impending violence. Third one is about the speech, where you'll be mentioning about quantity and the quality of the speech. Okay, under a quantity of speech, like whether he is giving a adequate amount of what I can say adequate amount of responses to the questions asked. So quantity of speech is whether normal or below normal or above normal, he is talking too much or he is talking very less or he is talking average, whether the quantity is average or above or below, that has to be mentioned. Then quality of speech, where the rate of speech. Okay, whether it is a monotonous speech like he speaks in the same volume, same what I can say same tone. Okay, then tone of the speech, then voice volume. Okay, the volume is very low, the volume is very high, or the average. Fluency of the speech, whether he is speaking very fluently or the fluency is not there, or there is a slurred speech or pressured speech. Okay, whether the slow speech, whether he speaks the speech is very fast that you can't understand, so where the speech is very minimal. So all those things has to be mentioned. So I just divided it in under a quantity and the quality. Okay, so next one is about the mood. So mood, under the mood you'll there'll be two types. Okay, subjective and objective. Subjective is the way the subject says. The subject here is a person with whom we are talking, on whom we are doing mental status examination. So the subject's answer to the mood. So you will ask him how you are feeling, how is your mood. He says yes, good, okay, fine. So that is subjective mood. Objective is, even though he says he is fine, he is good, objective mood, how is our like our examination, like how we felt about a person. When he says calm, it may not be always objective mode will be calm. Objective of a person's, he will not be calm. We may not feel he is calm. When a person is saying subjective mode, when he says he is calm, and our objective expression should be like whether it is a calm, whether it is anxious. So that is our, okay, our examination. So objective mode is what we felt about a person, about a person's mood. Subjective is what the person feels about his mood, what he says about his mood. He may be saying true or he may be lying, But subjective mode, as he mentions, that we need to mention that objective mode is our assessment about his mood. That is objective mode. Okay. Then perception. About a perception and the thoughts, we should know like whether his perception is normal or abnormal, whether his thoughts are normal or abnormal. Okay. Under perception, there are two types of abnormal perception like illusion and hallucinations. Okay, whether he is having hallucination, auditory or tactile hallucination or visual hallucination, or whether he is having illusions, we should find out. So the way he look into the word, the way he look into the situation has to be assessed. That is perception. And under the thoughts, you will be questioning or you will be examining about a stream of thought, about a content of thought, about a form of thought, okay, about the position of thought, like what he is thinking, what are his thought content, okay, what he speaks about, what he thinks about, how is his thought, whether he can link his thoughts with things, whatever the question is asked, whether he can give a proper thoughtful answer to the questions. So it is about the thoughts, whether it is a normal or abnormal thoughts we should find out. Okay. After the perception and thoughts, it is about the memory. So memory, where there are three things we should cover, that is immediate, recent and remote memory. Immediate is the few seconds before what happened. Regarding that we can question. Maybe like as you started the session, you have told your name. So after a 2-3 questions, like after a 5 or 10 minutes, you can ask the person what was my name, what I told. Okay, immediate memory. On recent memories, just maybe 3 hours, 4 hours before, just in the morning, what he had breakfast, what was the breakfast in the morning, that you can ask the recent memory. Okay, what was the yesterday's dinner? Okay, what you did yesterday? What was that situation? That you can ask that in the recent memory. Remote memory is that where the person will be where we need to find out whether he is having a memory of a remote things like a very long, or I can say the past incidents, maybe about his birthday date, maybe about his when he got passed in 10th, what was his first day of school, when was it first day of school. So you can ask about the birth dates of his parents or something like remote memory, the past incidents. So we need to find out whether his immediate memory is intact, whether his recent memory is intact, whether his remote memory is intact or not. That has to be found out. Next one is about the cognition. About the cognition, where we'll be asking questions about his intelligence, maybe what is the thinking capacity, maybe about his abstract thinking, how is, whether he's a creative person, abstract, he can think abstractly, or whether he's having a concrete thinking. So different aspects of cognition can be questioned in under a heading of a cognition. Okay, so you can also discuss about his clouding consciousness, about his orientation also you can ask under the cognition, but I have mentioned in a different heading also. So it's about the his thinking process, about his intelligent, about his awareness. Okay, so that has to be found out. Then judgment. Regarding the judgment, you will be giving him some situations where he'll be having a difficulty to manage it, or some difficult situation, how he takes decision about it, how he manages to overcome it. So giving an example of few situation, and he has to judge it, how he manages some kind of situation, such kind of situations. Next is about the orientation. In the orientation, where we'll be asking about orientation about the place, orientation about the person, and orientation about the time. So whether he can say like what time it is, whether it is afternoon or in the or it is a morning or it is a evening, and you can ask like which place he is staying, from which place he came. Okay, and you can ask about the persons with whom he is staying, who are they, so whether he can identify them, whether he knows about them. So orientation is awareness about a place, person and the time. And the last one under mental status examination is insight. Insight is about it's awareness about his problem, his own problem. So whether a person knows, whether a person has knowledge about his problem or not. Okay, so in insight there are three aspects, like the insight present, insight absent, insight partial. At times the person knows that he has a problem, but he don't know clearly what his problem is. Not very clearly he has an idea about his problem, but he knows there is something, there is some problem. So that is partial insight. Or at times the person says like he has no issues, just he with the force of, for the force of parents he came to hospital. So it is like, so insight is absent, he has no, he says he has no issues, there is no need of he coming to the hospital, he has no problem. And at times he says, yes, I have a problem, I used to feel anxious, that's why I came to psychiatrist to take the treatment. So that is a complete insight. Okay. At times in the inside there will be acceptance, there will be no acceptance. The person says, yes, there is a problem, but I don't accept it is a problem, I don't accept it is because of my mistake. Okay. So inside there will be acceptance will be present, at times there will be no acceptance, at times there will be partial, at times there will be complete insight, at times there will be absence of insight. Okay. So hopefully the mental status examination, I have given you a clear picture about the mental status examination in this session. If you are finding our videos useful, please subscribe to our channel. Thank you so much.